That'll wake you up.
Okay, good afternoon, everybody. This is our first event this year on the series of the Council Connections. This is a program that has been started close to 2 years ago. And what we are doing is we are inviting either people from any of the positions of management or from of the interest groups or some committees. And so we can talk not only about the technical aspects of what they do, but also a little bit further and exploring, other things about their personal life. We don't go into very much detail about that, but so this is going to continue happening every Wednesday, every Thursday at 2 o'clock, the day that the council meets. So it's the third Thursday of the month. So without further ado, I will give the mic to Michelle, who is going to interview Mary Jo.
Okay, hello, everybody. I'm Michelle Cacavano. I asked actually to be permitted to interview Mary Jo because we both were in the same profession, so I thought it would be fun. Okay, Mary Jo, we've talked about some of the questions that we have here a little bit about a week ago. So the first question is, when and why did you decide to go into the field of nursing?
I know a lot of people think that you always know you're going to go into nursing, but it really wasn't my first choice. But I was raised around family members who were nurses and certainly in caretaking roles. At 14 years old, I was a candy striper at a hospital. So I did get some knowledge from there. And that also went to when I was a Girl Scout. We used to go to an adult home sometimes and read to people and open their mail. So that was definitely an exposure that I had. And also we, beyond that at college, I decided to go into early childhood education. So that was my first 2-year degree. And I had a co-partner and we did have the Hyde Park Nursery School for about 7 years together. So 3 to 5-year-olds. And I had a friend who was a nursing assistant and they needed help at the nursing home. Better off.
Yeah, the sound of quality would be a little better if you hold it. Gretchen, is that why you're motioning us? Okay.
Is
Sure.
that better? Okay. So then after, early childhood, and I became a nursing assistant just to volunteer really a little bit on the weekends. And then I became a nursing assistant for 9 years. So that was really certainly an avenue. Worked with some wonderful LPNs who encouraged me to go to school, go back to school and become a nurse. And if you're going to go to nurse, they said, go become an RN. So that's what I did. And then, yeah.
That's funny because we had sort of a similar path and we wasn't going into nursing either.
No.
Yeah.
No.
Okay. You may have partially answered this, but maybe you could expand on this a little bit. What or who was your greatest influence in making the decision to go into nursing?
Right. I think along the way, there's so many different clues that invite you to come in. I used to always say to myself, it chose me. I'm not sure I chose it.
Mhm.
It was like this avenue opened up, this door opened up. I got readily accepted into a program. I won a grant to go back to school. And at school, some of the professors were just so intriguing to me. And I ended up really liking science, which I couldn't believe I liked science like that. So, when you go through anatomy and physiology, you think of, dissecting anything if you would have said that. But I ended up really finding it so fascinating how everything works. And so that was always a surprise.
Mhm.
And certainly colleagues and workers that I worked with. And when you're part of a team, no matter what level it was. And again, I was going back to school as a nursing assistant and just helping people and seeing that every day. So is there just one face? There's many faces that you see along the way that you just want to show up the next day.
Can you tell us a little bit about your education?
Yes. So my early childhood degree was at Dutchess Community College. It's a 2-year degree, associates in science. And then I went back to Dutchess Community College and got my 2-year degree in RN. And after that, I did go back to SUNY New Paltz here. And when they did have a nursing program, and I did get a bachelor's degree, and I stayed because they also were giving out grants at that time. And I was fortunate enough to win the Resnick's Foundation, and I was able to have some of that help be paid for my master's degree in geriatrics.
Most of us have kind of migrated into all different areas of nursing. It seems to be a trend in nursing.
Definitely.
What types of experiences have you had in nursing besides this geriatric?
Correct. When I started out, you're right, in geriatric. And then I kind of moved, and the nurse buddies at the nursing home said, you really need to go to the hospital. You got to learn those skills, and then they were encouraged. So I did work at 3 different hospitals, and then I ended up at Northern Dutchess Hospital the longest. And certainly being a small hospital, community hospital, it's expanded now, of course, because now it's more vaster, but back then it was 55 beds, and we didn't have an IV team or anything like that. You were taught to do everything. So you could have chemotherapy, and they need help in the ER for a couple hours, and then they had babies being delivered. And so you just kind of learned many things that way, as far as hospital work. So, but I did like a lot of surgical and recovery room. And we used to do PAT, so patient education before you come in for surgery. And that meant children. And I actually got to be in a film that we filmed there to teach children not to be afraid of the hospital. And Dr. Zipser was pretty instrumental in making that film. So we used to show this film to children coming in for tonsils or appendix or whatever, and families what to expect. And so that was pretty fun. And but I knew that I wasn't going to stay in acute care for my whole career. I kept thinking, I don't know if I can do this. So when I was back at New Paltz here and studying geriatrics, I was like, oh, this is just wonderful. And even when I was a nurse at the hospital, I was often traded or asked to trade. Could you take the nursing home patients in room 10 and I'll take 3 of your patients? I just loved it. And they were like, I said, all right, that must be what I like the most. And so I did go into geriatrics from there. And after my master's degree, I did get what they call a clinical case manager in a nursing home. And that grew into like what we might call an assistant director of nurses. And then I was a director of nurses in 3 facilities over 14 years after that. So before here.
Now, as you look back over your career, what would you say your biggest challenge has been as a nurse?
I think to stay current all the time, the challenge is nonstop. People caring for people is always there, but the devices, resources, and communication with everybody has always been a challenge. As you deal with maybe regulations that constantly change. And, there was definitely challenges with staffing and growing a team that works together. And that is, whether it's in this industry or any industry, is really a lot of hard work.
Did you find that if you kind of put the team together, those teams worked best together? In other words, if you started a team from the ground up, did you find that those were your happier experiences? I'm just going by
It's true.
something I felt.
That you felt too.
Yeah.
Yeah. I mean, there's certainly teams I jumped in on, and I was grateful for their years of experience ahead of me that they could share. And there were teams, you're right, as you grow, when you stay at a job for a long time, you grow that team with you. So if you stay 2 years, I don't know if you're going to have that. You stay past 5 years, you have a really pretty good team you've grown up with or together, right?
Yeah, great. Now, you did talk a little bit about the different roles that you've had. Are there any that you didn't tell us about?
Well, not in nursing, you're right. I've always done a few other things on the side or whatever. A fellow nurses also worked in real estate, and I got my real estate license. And so some Saturdays off, there wasn't, cell phones and computers. We had to sit in the office and answer the phone. And so I did real estate, and that's how I got my notary. by the way.
That
And,
answers that question.
Right. Well, one of the nurses I worked with, her mother had a real estate agency or brokerage, and she needed help. And so she helped us to go study at BOCES and get our, and so that's what we did. So it was a whole different avenue, but it was really wonderful. You're still working with families and people, and
Well, your
so
people skills.
people skills just came
Yeah,
through
well, they
as far as
translate
that
into
goes.
anything.
Right.
Mhm.
And then I also have studied in like aromatherapy or some holistic practices. They did, therapeutic touch and different things. I did 3 years of oncology nursing, and that was certainly a huge challenge and a huge education to go with that. But 3 years was a lot to do. So I found out maybe I was made of jello sometimes, and I couldn't really do that all the time. That was really difficult work.
What made you decide to transition into a CCRC?
Well, when I was training and going for geriatrics master's degree, that's the first time I ever heard it was a CCRC. Also, my grandmother decided, we're from Buffalo, New York. She decided.
I'm sorry to interrupt. Can you mind if I take these stands and you can hold the microphone since you're so comfortable?
Sure.
Because we do need the stands.
Sorry about that.
That's fine. That's fine, Richard. Yeah. Okay, let me think back.
We were talking about the CCRC.
Yeah, the CCRC model. So my grandmother decided, she had a friend who was out in California, and she just decided, I'm going to go see my friend. Well, she lived in a compound, which seemed outrageous back in the 80s, but they had a church on campus, a grocery store on campus, and everyone who lived there worked at those places. So she got to bag groceries on Tuesday night and, and it was kind of fun, but then they had buses that took them to concerts and all kinds of things. So that was my first entrance that I thought it sounded similar to it, but going to school in geriatrics, they were looking at different measures. Now I did work in long-term care, and I was like, because if you work hospital and someone has to go to a long-term care, it used to be, you don't really pick it ahead of time. They can't go home alone. They don't have anybody, you pick one. So the CCRC model was so wonderful under one roof and just exploring that. So I was actually 2004 sitting at a Chamber of Commerce meeting here. I belonged to another facility then, and they mentioned the word Woodland Pond and CCRC. And I was like, wow, right here, Hudson Valley. This is great.
Mhm.
And so that was exciting to know, but it took them since 2009 and all the regulations and all trying to get it going. And I did know another nurse who had my position here that I'm in, and she was a student of mine. I also precepted students for their masters at New Paltz. And she said she was moving on and thinks at that time she knew I had left my other job and said, what are you doing? You should apply for this. And I'm like, are you kidding? This is awesome. So
No,
that's how I did it. Yeah.
Yeah, it's funny how those kinds of things
It
happen
just
in
kind, like
nursing.
I said, it kind of chose me again.
If you think back, what would you say your greatest joy has been in practicing your profession as a nurse?
I think at the end of a shift or a day, to be successful, even just for one person,
Mhm.
because I know you're not going to please everybody, but for families or for this, if you're walking across the street and someone yells to me, oh my gosh, it's nurse, and I don't remember their name, you know what I mean? But I gave them chemotherapy 15 years ago, and they remembered me. Like, it was amazing, right? So some of those moments don't happen in this moment, might happen and catch you by surprise, but you didn't realize the impact you may have had.
I'll tell a funny story just to add to
Go
this.
for it.
You're always wearing scrubs or a white uniform or something. And sometimes people don't recognize you when you're not in your scrubs or your uniform. And one time I was in a grocery store and a patient did recognize me and yelled across the aisle, I didn't recognize you with your clothes on. So we had a good laugh over
That's a
that, but
good one.
yeah. So what would you say, let's go to the other aspect. What would you say
Yes.
is the most frustrating aspect of
Mhm.
nursing?
Mhm. I think there's definitely daily challenges, and it really does, to me, have to do with your own energy and psychosocial of dealing with things. You can't read in a book how much it is to go to patient to patient to patient. It might be more hospital or more even nursing assistant. And just the physical exhaustion, you don't even realize it because you're kind of pushing through it. And same with your staff, if you're trying to help them stay up and face it too again. And, you know, to find that daily energy input to do it, to stay up at that level, to do the care is very, very, but that's when you need each other to lean on, good day, bad day. But you do have to have self-care, and you don't always have that, but you have to build that into your world, because if you don't have self-care,
You burn out.
you just burn out.
Mhm.
And you don't recognize burnout sometimes, right? People don't recognize burnout. We used to have to say that to each other after taking some classes. You learn about burnout to point it out to each other,
Mhm.
because sometimes you just don't. It's like, you know, whatever. Yeah,
Well, I think nurses are so busy taking care of other people
all the time,
that they never are worried about what's
Mm-mm.
happening with them.
until they also have a medical issue.
Right.
And then they go, oh, yeah, yeah.
What would you say is the public's biggest misconception about the role of a nurse?
Well, that goes way back, I guess, right? Whether it's
Mhm.
TV shows or just the way people would dress or interpret things, like, which is true. Now, there was studies, right, that went way back that said they were the most trusted.
They still
profession.
are.
They're
They-
still the most trusted.
Yeah,
yeah,
in the
yeah.
US. Yeah, they win that every year.
They won that every year.
I don't think there's ever been a year that they didn't.
Well, I think COVID may have changed that a little bit.
I think COVID actually helped people understand the importance of
The role.
nursing. Yeah, I think that was the one positive thing to come
Yeah.
out of it.
Yeah. The need
Um,
for them.
Yeah, in fact, that was my next question. Do you think this changed after the COVID
I
pandemic?
think there's been pockets of up and down with it, to be honest with you. You know, even among the profession itself and even among fellow nurses,
Mhm.
you know, discussing this, discussing that. But now we have what? You know, we have social media. We're just bombarded with so much. Is it all information that we can take to the bank, or is it all, we're not sure, you know, opinions and stuff. So in the meantime, you don't have time for that when you have people who are so ill.
What are your goals for your role as a nurse at Woodland Pond
Well,
for the
certainly-
future?
Yeah, certainly to do my best every day and
Mhm.
stay with the challenges that we face all the time. Yeah,
Would you say since you've been here, COVID has been the biggest challenge that you've had?
it has. I think it has
Mhm.
been. Just going through a lockdown like that was unheard of when we were like such free, you know, all over to do things.
Mhm.
Certainly a challenge for everybody, and stay connected, make sure everyone's okay, you know, just the basics at some point, because you weren't able to see physicians, right? We're trying to do televisits and make sure everyone reports everything, and then you have to go check on them, you know? Yeah.
For my last question, I myself didn't think about this probably till the last 5 or 6 years in my profession. And I started to actually bring this up in the classroom because I taught in my last 10 years. And I gave a lot of thought to it. And I wonder if you have also. When you look back, what would you like your legacy as a nurse to be?
Mm, mm. I think just to show up every day
Mhm.
and to work as a nurse. I don't care what arena you work in. And to do that sometimes takes everything it takes, you know. But I think you also inspire, help, not just patients and families go through things, but you do, you know, your coworkers, or maybe you did inspire another nursing assistant. You should really think about going back to school, or, you know, a colleague you work with, you know. Physicians have bad days too all the time. They could use a little, you know, cheering up and stuff. So I do think just putting, I remember one nurse always telling me, when you sign your signature, no matter what it is, you put that RN after it every day.
Is there anything you would like to add to this interview?
I don't know.
Yeah.
No.
Any funny stories?
Oh, my goodness.
I
me.
think we all have funny
Well,
stories.
sometimes there's funny stories and there's embarrassing stories, but
Right.
you know what I mean, without using anyone's name or anything. Yeah. I mean, there are moments, and I think we used to say we develop kind of a sixth sense of humor sometimes in healthcare. Is that just stress relief, or is it, you know, something that comes up? It's pretty interesting though, like through all of it. Yeah.
I remember when my nephew went into nursing school, and I said one day, after you've been a nurse for a couple of years, you're going to turn around and you're going to look in a room and you're going to notice that most of the people that you are with all the time are other nurses. And I think that's because you speak the same language
Right.
and you understand each other without even speaking,
Yeah,
so.
that's true. That drifting together in
Yeah,
some
yeah.
ways there too.
Yeah, you tend to have that core group of people that you
Yeah.
talk to about the issues. Because there's
Yeah.
some things you just can't share with other people that
That's true.
haven't been in the profession.
That is true.
Yeah.
That is true. And I think that was some of the hardest points to get through because you might have like certain things when you're going to school or book learning, but when you're actually out there, there are some really hard moments in every second of hard moments. I never expected to see a colleague, we're calling for a stat downstairs in a bathroom, but it was a colleague who had just overdosed, who had a tourniquet on their arm, and they had just shot up a medicine and they were taking medicine, upstairs as they were working. It was absolutely devastating to know that. And this is someone deeply admired. And, but to be that suspicious of someone was just very difficult. So the
Mhm.
pressure, what built that person up to get to that point, but that no one else really noticed at that time because we're all just.
Yeah, I think there's a lot of guilt associated with that for other nurses when that kind of an issue happens. Why didn't
Yeah.
I see this? I could have done something.
I could have
about it.
helped her. I could have made sure this didn't happen,
Right.
But yeah, so there's moments like that. And then there's times when I think too, we are just way too serious. Like we are serious all the time. We are serious about, you know what I mean? To make the good of it that goes through it all too.
Mhm.
Yeah. Yeah.
You're right about the sick sense of humor, though.
That's very sick. Yeah.
I think that's universal.
It's very universal. And it's true though, because I remember watching one of the TV shows or something like that, and they used to guess what was, the blood alcohol level. Oh, this one's got to be this. And they actually did do that a lot.
Yeah.
Or with the panel light up. How many drugs on the drug panel are going to light up, and things like that.
Yeah.
It was a full Christmas tree. Yeah, it lit up, so there's some things that you just don't realize. Yeah.
No, it just happens slowly over time.
But I
as you're
do
in a
think the
profession.
rewards are just in everyday simple things. I don't think it's, it's nice to get awards and to be recognized, but I do think it's the thank yous and a little thank you card or something stopping by or just like, oh, I'm so glad you're here today. I can just talk to you. Like those are the moments.
Yeah, I remember somebody saying to me once, it must be such a burden to be a nurse. And I said, no, it's not a burden, it's a privilege.
Yeah, it's
And
always a
they're-
privilege. I
Right.
agree.
Yeah, and they were kind of surprised, taken back by
Yeah.
that.
Yeah.
Because when people look at nurses, they think about all the bad things,
Right.
so they don't know about all the good things.
There's a lot of good things.
Yeah.
There's just a lot of good things. They're really, really good. And within our own family and friends and circles and stuff like that, like, oh, I'm sorry, it's so late. I just want to ask you something, It feels good though to help, even if I don't have the answer, it's good for them to discuss it and look it up. And if I can look something up and help them, I'll do it, But yeah,
So overall, you're glad this was your profession.
I am.
Yeah.
I am very glad, very glad. I couldn't imagine, doing everything else, There were tough years as I was a single parent raising kids. I did pick up many shifts and I was always, a little bit on the go too much there. So, but they're healthy and strong. And I was glad to have a profession where I could grow with it too and change. And you're right. It was great to be able to change. Back when I first graduated, you always went to med surg for at least 3 years. You didn't walk out of school and walk into a specialty unit. You just didn't. You had to earn it and get up there. So that was quite different, but the medical surgical floors were great. And you learned to be quite flexible with what's coming in, what's going out. And so you're always assessing and learning.
Actually, that's one thing you and I talked about before this interview, was that the one thing that I learned by being thrown into an intensive care unit right out of school was to never let anybody else do that. Yeah, yeah, it was- yeah.
Yeah,
Most
it's-
people should go to med surg for at least a year or two,
Yeah.
get their feet firmly planted on the ground before
Mhm,
they're in a specialty area.
Yeah.
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 I know my nephew wanted to go into emergency room nursing out of nursing school, and I said, don't do that. So we had a big,
Yeah.
long talk about that.
Yeah, that's a lot. That is a
Yeah.
lot. That is a lot. I know when we were first learning to pass medications, right? How many medications do you pass? There's a lot of medications per patient sometimes, right? And time frames and everything else. We used to have styrofoam med trays with cards that you wrote on. So, I mean, it seems so funny to even say that out loud. So next thing you know, they were bringing in blister packs, and the older nurses who were used to the styrofoam boards, writing the little things on the little cards, quit because they didn't want to change. And this one older nurse stayed on, and she said to me, never be afraid to change.
That's
She
true.
says, embrace it and just learn it. Just learn it, you know? So when they were doing those automatic machines where you fed your own blood back to you or whatever they were
Mhm.
called. Anyways, she said, I'm not intimidated. I'm just going to learn how it works, you know, and go to every, in service there is, read everything you can on it and become good at it. Don't run away from it. Don't be afraid.
Yeah, I remember that happening in a hospital I worked in when they computerized everything.
That's what happened to me too,
Yeah.
computerized. So they went from blister packs, then we went to computerized, and the whole desk people all quit.
Yeah.
Within the first 2 months of bringing computers to the desk.
And
We
then,
used-
like you said, there are people that just embrace it and go along with it and
They're
learn
like-
it, and that's it. And those are the people that survive.
Yeah, yeah.
And stay in nursing, so.
But it's exciting to learn new things and
Yeah,
technology.
yeah.
It's exciting.
You don't want to become stagnant and not learn.
No, I
Yeah.
mean, to think surgeries that would come in for a gallbladder would be with me for 2 weeks. I would see them through the whole spectrum, whether it was primary nursing or district nursing, whatever we were doing. And now they go home the same day with laparoscopic. I mean, that was huge.
When I think about the changes that have occurred over my career, it's
yeah.
incredible.
It's incredible.
Just from my first day to now, I mean, it's unbelievable. I would have
Yeah.
never have anticipated that much would have changed the profession
Mhm,
in that
mhm.
short a period of time.
It's true.
Yeah.
Because I was thinking, well, we talked briefly too about when I first started right in the 80s learning school, it was AIDS. We didn't know what AIDS was, HIV. We didn't know how you get it. We were all gowning and gloving, and there
Mhm.
was, personnel who wouldn't go in the room if it was suspected on somebody. Okay. It was very real. And now here you have COVID. And I'm like, whoa, we didn't know what we were dealing with. It's kind of like the same thing again.
And the Ebola scare.
An Ebola scare, same
Yeah.
thing.
I
Yeah.
remember going through that in the hospital, getting prepared for what they thought was going to
We had
be.
infection control meetings every
Yeah.
single day. We had to do this. Yeah. Yeah.
Yeah. It's pretty fascinating what medicine has gone through
Yeah.
in our lifetimes.
In our
So,
lifetime. Yeah.
I mean, 60, 70 years ago, we didn't even have open heart surgery.
Mhm,
So,
mhm, mhm.
It's incredible.
I know now you got computers in your pocket. You can look things up. I used to carry my little drug book with me forever to look up maybe a medication right away, and now it's like it's at your
It's on your
fingertips.
iPhone.
It's right on your phone. It's like
Yeah.
1, 2, 3.
Yep. First thing I taught in pharmacology was, this is the app you're going to put on your phone to look up a medication.
How different
So,
was that from
yeah,
when
yeah.
you first taught
Right.
pharmacology?
All right. Well, thank you very much. It was an
All right.
interesting interview. I enjoyed sharing this time with you and talking about our wonderful profession.
Thank you so much. Any other questions? Anybody? Sure.
Sure. We've never done that, but let's do it.
No, in other cases, we have done questions. So first of all, thank you very much for your contribution to the Woodland Pond in general, but especially during the past 2 years with the pandemic. And I wanted to talk a little bit more about that because we've all gone through it together. You've been a linchpin, if you like, to the whole process, you and a few others in management. And I think we're all very grateful that that has gone so well for us. And now we think maybe we're coming out of it. I personally am very concerned that there's over enthusiasm and the throwing off of masks is wonderful, but we may have to put them back on again. We don't know.
Mhm.
Anyhow, I say that's in preface to my major concern, and that is sort of mental health more broadly, because this has been a very isolationist kind of situation.
Mhm,
And I know that you've been concerned about that.
mhm.
Could you speak a little bit more about what the level of, how important the issue of mental health has emerged in these past 2 years, especially, and how you advise you should be dealing with it in your position, but
Mhm.
what advice you might give to the larger community on that?
Right. It certainly has affected, I think, each and every person and each and every family, because just think all the patterns were disrupted, like kind of abruptly. And people experienced loss within their family because of COVID, and you couldn't even go to a funeral, right? They didn't even have wakes. They didn't even have things. That was tremendous. There has been so many conversations about that, to reach out to each other on things like that. It's true. And what did we have? You couldn't even call in a counselor to come sit and talk with you, right? We had televisits with everything, which helps a little bit, but it still doesn't really reach everything. It's the best we had. It was a device that we had, and you're right. I even used my own personal phone to help people call their family and talk to them and things, because it was needed. And they didn't know how to work devices, right? We've got plenty of people who don't own a device to do that. So to reach out to our neighbors, but I think it is about being in touch with yourself, but being in touch with others too. But being in touch with yourself helps, because if I'm going through it, I know there's got to be everybody else going through it. But what works for me may not work for you. I like to walk and do things. Some people, you find them more isolating, and that's the people we got to zone in on or call more, stop in. Sometimes I've just brought a cup of coffee, up just to say hello. No agenda, no doing anything, just to reach out. But I've seen it through the whole thing of everybody reaching out to each other here. Certain floors or units, they become a unit and talking to each other all the time. But it is taking clues and to say, I do think I've reached a point where I need more professional help with this, for sure. And I know now that some groups are out, I which is helpful. Again, you can just feel the elevation already in somebody's moods and things. But I do think it has to start with definitely whether it be primary physician or something like that to help out, but also to listen to families to reach out.
I agree.
Yeah. But I don't think it's over either, George. I think we have some caution for sure. You're right. I think we're in a down peak, but I'm not sure it's going to go all the way down. I'd like to think it would be, but I think we should enjoy the moment that we do have, as safe as we can. I'm still wearing my mask to go to stores. I'm still not going to restaurants yet. I just don't feel comfortable with that.
Today was the first day I didn't wear a mask at a meeting. Because I knew everybody was vaccinated, and I thought, well, I guess I can try this, but I still wear a mask in the hallway.
Yeah.
We've been through too many variants to not be suspicious.
That's true.
Yeah.
That's true.
So,
Yeah. I asked before I came in here if I can leave it off.
yeah.
But I feel do better wearing it, because I also see other people. I do leave the building every day. I don't have a lot of people over or anything like that, but I still, there's an access to how many people that leave every day and come back in. So wash your hands, still stay hydrated, right? Still all the basics.
That was wonderful. I mean, I had the pleasure and the honor to work with nurses for probably about 40 years, or no, 30 some years, until they retired, basically, in radiation oncology. So we had nurses in our department. We became friends with nurses. And so, although I'm a physicist, but it's physics in medicine. So, and I wondered, I mean, and also we had teams basically working, physicists, technologists, nurses, social workers, the physicians, and so on. Do you feel that, I mean, the fact that here, in your position here, you are not interacting as much with physicians, or am I wrong?
No, I think most of the physicians have been really good to reach out to. I definitely know more, or some more than others. Do you know what I mean? I mean, we still have people who say, I don't do anything with doctors. I don't want to talk to doctors, but yeah, but there's all kinds, you got to appreciate certainly the free will of everybody who looks at it from different ways. But I find they were very responsive. Yeah. Once I got through, sometimes dialing has been tough to get through. Yeah. Yeah.
Any other questions from anybody? Okay, guess we're done. Thank you.
Oh, thank you all so much for having me. Pleasure.
Thanks for coming.